After looking at coronavirus statistics, the governor says the pandemic has really shed a light on racial disparities when it comes to health care.
We are very excited and very supportive and elated about this decision.
That's the reaction from Dr. PATRICIA WILKERSON-UDDYBACK with DMC to the governor's executive order. The order requires healthcare workers to undergo implicit bias training. Looking at the pandemic numbers, Black Michiganders make up 14% of the population, but account for 40% of coronavirus deaths. DMC has already started training their residents to identify social determinants of health.
Their environment, their culture, their race, their access, their economic status.
But now they plan to include implicit bias training for all employees by the end of the year.
Everybody has bias, but people don't necessarily even know that they have bias.
Ascension has already implicit bias training in their system that includes for the workplace and for dealing with the public. Their training also addresses what happens when patients act on their implicit bias towards minority doctors and nurses.
Walk into the room and the patient assumes they're the nurse's aide.
The governor's order requires the state licensing and regulatory department to consult with experts to determine goals and concerns under these new rules by November. Many healthcare officials are proud to have taken the lead. For example, Michigan Medicine in Ann Arbor has had employees go through implicit bias training for the past 5 years. Now they're on phase 2 of training to teach 14,000 employees how to change behaviors and actions.
You don't get cured from taking these trainings of your biases. It's an active process and it requires introspection and self-accountability.
And for more on how other healthcare systems are reacting to these executive orders, just go to our website at WXYZ.com. I'm SYMA CHOWDHRY for 7 Action News.
All right, thank you so much, SYMA.